Hello everyone, it's Michael again with Home Health Success Academy. Thanking you guys for joining us for another one of our free videos on how to be able to help your home health, your home care, your hospice company increase more clients. A lot of questions gets asked out there about who to hire as marketers. So me personally, with my experience out there, I always like to make sure that I hire people that have experience in sales or marketing. They don't have to have experience working in the healthcare industry, or especially working in the home health industry. The reason why is good salespeople out there, good marketers out there don't need to know don't have to have experience in the healthcare field. They just need to be able to sell products. Your goal is to then be able to show them your product, the services that you offer, the things that makes your company stand out from the others. So when you hire somebody as a marketer, they should have at least experience working in as a marketer, or who has experience in making cold calls. People that are very personal, people that are very outgoing. Those are the type of people that you want to work for you as a marketers. Now, they don't have to have a nursing degree. They don't have to be an LPN or an RN. At the same time as when you have an LPN and RN and you hire them as your marketers, you're going to have to all of a sudden make sure that their rate of pay is a little bit on the high pay grade, on their level that they're used to when they work as a person, as a nurse in the floor. So one thing I always suggest is that they don't have to have experience, but they don't have to have experience in the healthcare field, but they have to have experience as a marketer or as a sales rep in previous jobs that they've had. And also add to this, sometimes when you hire somebody who has experience as a home health marketer, you can get two things, is this, a good and a bad marketer. Because if they were a good marketer, if they were a good salesperson, why are they leaving the company that they're working for? So you want to be able to make sure you ask that question if all of a sudden they're leaving another company wanting to join your company. And always make sure you do this. Always follow up and call their previous employer and find out a little bit more about them. See what makes this person tick. See if they have any skeletons hidden in their closets. You want to be able to make sure when you hire a person that they are good for your job. And when you hire somebody, never hire an employee, whether it be a marketer, a nurse, or a home health aide, or a caregiver, or even a therapist, without interviewing them. Okay, and when you interview them, an interview should be more than 3 interviews. You should have an interview with, if you're the administrator or the owner, you should have that direct interview with them. And at the same time, in the second interview, you want to bring in people from your office or other nurses or other people in your organization into that meeting so that they can ask questions that possibly you forgot to ask. And see the feel of this person and how he interacts. Because if he interacts well with your employees and with you can see that maybe this person will interact well with others outside. So it's a matter of being able to make sure that they can build good rapport. And also, you want to make sure that they have good phone skills. I always like to give them a try. When somebody comes in and they say, okay, Michael, I need you to help me hire a marketer. So I go in there with an interview. So the administrator, the director of nursing, or the owner is going to be there with me in that interview. And I would say, okay, you know what? Let's see what you have. I will give them a phone and I will say, all right, why don't you give a call to somebody, call so-and-so doctor, and go ahead and try to set up an appointment in front of me. I will give them a test. Some people say it's a shit test. I'm sorry for the language, but as a marketer, as a person who's been out there for a while, we like to make sure that whoever I hire for a company, they are going to be a good fit for that company. And in addition to that is you also want to make sure, depending on what they're asking for pay scale wise. And the next video that we're going to be having is giving you information on what are good pay scales for marketers to work for your company. So like I said, they don't have to have the experience in the healthcare field, but they have to have experience working in sales and marketing or making cold calls. These are things that people need to have. One good skill that a marketer should have is they should be able to take a no and roll with it. Who cares if they get a no? And if they get rejected, that they feel okay, that it doesn't bother them. Because one thing in marketing is you're always going to have a door shut in front of you, but you better be a damn good marketer to be able to walk into the back door and be able to go in. So once again, this is a little tip that's coming from Home Health Success Academy. Thank you so much for watching this video. We look forward to seeing you guys and have you attend one of our live events. And at the same time, make sure to understand this. Healthcare marketing is not hard at all if you know what you're doing. So let Home Health Success Academy work with you, with your marketers, with your team to make sure that your census keeps on going up, your phones keeps on ringing, and have those referrals just rolling in. Thank you so much, and you guys have a beautiful day.